What's up, everyone? Welcome to week 2 homework. Our mission this week is to expand the workspace by training our shoulder and hip internal rotation. Last week we did a ton of assessing with our cars and capsules and probably found struggles disassociating one joint from the next. After looking at some feedback and gauging the trends that I saw, what I found is a lot of people are talking about the shoulder and hip cars specifically and their struggles to disassociate shoulder motion from scapula motion and hip motion from spine motion. To me, when we see kind of a fusion of those joints moving together, it often means internal rotation is where we need to start. So we're going to train our IR this week, which we'll need a dowel, 2 yoga blocks, a tennis ball. If you have it, maybe a pillow to sit up on if you need to regress some of the hip movements. We're going to start out by doing the hip focus. Grab your dowel and maybe come to the wall so you've got some balance. But we're going to start with the right leg, run through the full series. We're going to assess and train some standing hip cars. We're going to go through some pails and rails for the IR of the hip. We'll be looking at a half frog regression, end at 90-90, and then we're going to do some challenges before we repeat the whole thing on the other side, and then we'll come to our shoulders. So for our hip cars, standing position, hold on to the wall for balance, dowel out to the side again for balance. That right leg we're driving up into flexion. Don't go as high as you can. Make sure the back stays still. Slowly open the hip. Make sure this lead hip stays forward. Freeze there. Internally rotate. Pull your heel up. Now, assess the workspace. How far can you get before your spine comes along for the ride? Now extend behind and finish through. So just forward reps today. I'm going to show you a little from the side here so you can see. So we flex, we abduct, freeze there, don't spin the hip, knee stays up high, IR. No shift in spine. Do your best to hold that position strong. Extend through. We'll get one more. Flexion, abduction, freeze, internal rotation, and extend through. Now, for many of you, you probably get to that weak point position, and we get right here, and as you pull your heel up, maybe we see that knee drop a bunch, maybe we see the spine laterally bend away, but usually that's that big sticky spot, and for those of you talking to me about some groin pinching, going through these basic movements, that's usually what I see is not enough IR and funky compensations happening making up for it. So to train that today, as I said, we're going to start with a regression and then move on to a progression. The first one is going to be called half frog. We pails and rails. Now, if your hip mobility is really limited, what I would suggest is when you do these at first, a light pillow, a small pillow right under your waistband. So as you lie prone, your pillow would be right here. It's going to prop your pelvis up a little and regress the ankle. So come on down, lying face down. As I said, you can prop up that low back a little if you need to. The right leg, abduct. So this is now that same weak point position we were just in. Make sure you're not too far, forcing you to round that low back or hike your hip. That's going to cause pinching in the front. If you're not sure, a little bit less high with the knee than you think. Big breath in and out times 3. As you breathe here, I just want you to think about the rib cage. Big breath in. Big breath out. Try and get the rib cage to pull down. Try and let the pelvis sink into the floor and flatten the low back. Now we're going to build up some tension. Your pails effort is going to be pushing this right heel down into the floor. So as if I was crushing the heel into a target. The effort would be as if I was doing this. Okay, we don't want the knee to lift, but you'll be pushing down into that heel. The rails effort is the opposite. I'll squeeze my thigh down and then internally rotate actively. As we do our rails, make sure, again, no spine compensation. So we breathe into it. Just one round here is our regression. Radiating tension through the core and glutes. Start to push the right heel into the floor. Squeeze the glute and press down. 10 seconds. As you drive through the floor, we're looking to get some recruitment and high lateral hip right through here. 5 seconds, staying low tension, just getting that hip awake. 3, 2, 1. Rails effort. Squeeze the inner thigh into the floor, actively adduct. Maintain that adduction and lift the heel. Internally rotate as high as you can. Make sure the spine doesn't compensate. Hold. 3, 2, 1, and lower with control. So, half frog, there's my go-to regression. By being prone, it's very easy to concentrate on that low back position. and to make sure the pelvis isn't jumping all around. So if you felt good recruitment there, or if it was challenging, feel free just to stay there and get another 2 rounds. Otherwise, we're going to come into 90-90. Again, this position, hip, knee, and heel, 2 right angles. The way we want to regress this is, if, again, you're struggling to sit up without the hands here, if you feel any pinch in the front, or you just feel like that shift where the spine can't be here, couple options. The first one is simply to elevate the front glute. So now I'm up taller, way less demand of this hip being here. It allows me to sit up tall. I can get into this position. Tails and rails, same thing you just did in half frog. Your tails effort crushing heel down. Your rails effort trying to adduct the thigh and lift the heel. Okay, so regression 1 is here. Regression 2 is simply to take the external rotation demands of the lead leg out of it by lifting the knee and blocking the knee. So either position, fool around with it. Again, you could be in half frog instead. To work on this position, what we need to do, turn our sternum towards that thigh. Now hands can be down if we need to be here, and you can be in this position, but if you can sit up tall, we turn the sternum. Notice the hip starts to shift down towards the floor. Allow that capsule just to drop. Try to resist that hip hike. If you can get both hands on top, great. You want to use your hands to sink some weight down into the floor and just breathe. And 3 nice breaths in and out. The idea is giving the nervous system time to relax into the stretch. If you need to regress, again, this is fine. So build up some tension, irradiate lead leg squeezing into the block. Trail leg engage glute, feel that core, big breath in, hold. Start your pales effort slowly. You're squeezing your heel down into the floor, pushing that heel through the ground. We want to search for that lateral hip engagement. 10 seconds, start ramping slowly. 30% to 40, 40% to 50. Drive that heel down to 60. Stay there. 5, 4, 3, 2. Rails effort. Adduct, squeeze your thigh down. Attempt to lift your heel as you actively pull your sternum towards your foot. Squeeze down, try and lift, and pull chest to foot. 5, 4, 3, 2. Sink into the stretch. So one more round there. Again, you could be in half frog, repeating there as necessary. Try and turn the sternum a little more over that thigh. Let that hip capsule drop down into the floor. Again, if you need to be here, that's fine. If you need to be up on that pillow, that's also fine. Same exact drill. So, second round, this time a little bit longer, a little bit higher tension. Searching to get that lateral hip working hard. Big breath in. Pales effort, start to squeeze that heel into the floor. 10 seconds, ramping 50%, 60%, 70%, 80%. Make sure it's pain-free. Don't push through any pain. Hold. That lateral hip should be working. 5, 4, 3, 2, 1. Rails effort. Adduct. Squeeze the thigh down. Try and lift your heel up and pull towards that foot. 5 seconds. If the hands are down, you're still trying to actively shorten that distance. 2, 1, and relax. 1 nice breath. And slowly, what we'll do next here is come into a bear sit position. Now we're going to challenge IR. So what we've done so far, we assessed it looking at our standing hip carve, kind of waking up the hip, seeing how the IR felt and was moving. We trained it, we had a regression from half frog, or we worked out of 90-90 using one of those 2 options. And now we're going to challenge it with bear sit hip IR hinges. So if it's tough to be in bear sit without using your hands, first option, hands stay down. Second option, just get this left leg out of the way and just straighten it. So what I want to work on here is hip IR of this right leg. So again, if you need to, hands down. If you need to, legs straight. If you can sit up tall and have the fists engaged, or you can squeeze the hands here, that's great. But we're going to work on hip IR. So it leads with the foot. I want the foot to plantar flex. I want the heel to swoop outside of the shin and start to pull the inner thigh down. Squeeze the inner thigh for the floor. Watch right here. Don't let it become a spine drill. If I go too far, that's a low back drill. So that's about it for me right now. And then I open the hip back out. So hands can be down. Heel swoops out, find that big toe, actively squeeze inner thigh for the floor. Try not to let that hip shift up. Glute should stay close to the ground. And reverse, same idea, you can regress here. Heel sweeps out, squeeze the thigh for the floor. Don't go too far and make it a spine drill. And reverse. Now, if as you do this, you're getting a big pinch in the front of the hip, it simply means we're in too much flexion and abduction. So sit up on your pillow. It's gonna make it a lot easier. That was 4. I want to get 6 total reps, internally rotating, squeezing, externally rotating back. Last rep. Very nice. We're all done with the right hip. Now we run through that same series on the left, starting with our hip cars. Grab your dowel if you've got it. Show you from this side. Getting 4 forward hip cars, flex, abduct, internally rotate, and extend through. Really check in with the workspace. Don't round the back. Don't spin this bottom hip. Hold, knee stays high, heel pulls up. Resist that urge to shift away and extend through. Last one coming up. Checking in with that hip. How's it feel in abduction and IR? Really common weak point. Let's come on down and train it. Half frog first. Again, if you needed to, use your pillow, prop up your pelvis. Realize half frog is a regression. If it's easy for you, that's okay. Use it to practice pails and rails. Squeezing the heel down, feel that lateral hip. Lifting the heel, re-educating inner hip to be involved. Come on down. Same idea, lift the pelvis if needed. If there's a pinch being here, please back up out of flexion and abduction. 3 breaths, try and flatten the low back into the floor. Both pelvis points sinking into the ground as you breathe. Big breath in, irradiate tension. Squeeze core, squeeze glutes. Start to press that heel down, crushing left heel into the floor. 10 seconds, ramp that tension, but control yourself. Push heel down, 3, 2, 1. Rails effort, squeeze thigh into the floor. Attempt to internally rotate without losing low back position. No change in alignment. Hold high. And lower with control. One nice breath. Now we're into 90-90. So again, it's the same drill. And as you go forward with this membership, you start to understand FRC and Kinstretch a little bit more as a system, realizing you can do any drill in any position you want. We like that prone half frog. It makes it simpler for the low back, and it's a bit easier just to be in the position. Next step would be 90-90. Tough to sit here. 2 simple regressions. Option 1, sit up on your pillow. Turn your attention to this trail leg. Less demand for the hip to be here. Option 2, lift the knee with the block. No ER involved with the lead leg now, allowing us to bring our attention to the trail leg. So if you need to be here, have that hand posted up, that's fine. Otherwise, hands are anchoring that capsule, keeping it low to the floor, giving us good habits. 3 big breaths in and out. As you breathe in, get tall. As you breathe out, let the hips sink. 2 rounds of pails and rails, build up total body tension, big breath in. Glutes, core engaged, start to press that left heel down. 30% tension, ramping slowly for 10 seconds up to 60. 40% effort, 50% effort. Lateral hip should start screaming. 60% effort, stay there, hold. 5, 4, 3, 2, 1. Rails effort, squeeze thigh down, attempt to lift the heel and shorten the distance of sternum to knee. 5, 4, 3, 2, sink into the stretch. Second round, notice as you breathe, a little bit easier to be here. Get up a little taller, turn the sternum back a little more. Again, pails effort, pushing the heel down as if you were doing this. Rails effort, trying to lift the heel and squeeze down as if you were doing this. Big breath in, radiate tension, total body engaged. Start to press that heel into the floor, starting at 50% tension, ramping to 60, to 70, to 80, and stay there. 5 seconds, fight here. You should be shaking and cramping. 3, 2, 1. Rails effort, squeeze that thigh down, try and lift the heel, pull into that angle. 5 seconds. And sink into the stretch. Back into our bear sit position, challenging ourselves now with 6 hip IR hinges. So, same idea. If you need to regress, option 1, sit on a pad, prop the hands behind you. Option 2, straighten that opposite leg out of the way. If you want to challenge yourself, you can always lift the hands, make it a little more challenging. Big breath in. Leading with the left heel, swooping outside of shin, bring your weight to the big toe. Internally rotate, squeeze that thigh down. Find end range hold, open that hip back. Big breath in. Internally rotate, find big toe, lift pinky toe, squeeze for the floor, and reverse. If you need to regress further, try that leg straight. Again, not going too far and letting that back do the work. Keep that hip close to the ground. Last 2, challenge yourself. Squeeze that inner thigh. Remember, big focus here. Not as important how far you're going, much more important to disassociate. Make sure it's just hip IR and not spine coming along. Last rep, finish through. Now we shift attention to the shoulders. So that's the hip series. Tails and rails again, a little tricky at first. Half frog, nice regression. Option to sit up on the pillow, another regression in 90-90. Or we prop up that lead knee in 90-90. One of those should do the trick for you. Just make sure as you start doing it, the position shouldn't cause pinching in the front. And as you work, we're trying to get lateral hip engagement. So let me know if that's confusing. Moving on now to our shoulders. Grab again the dowel, work right shoulder first. We're just gonna do now 3 reverse shoulder cars, starting an internal rotation so we can kind of assess the workspace first and then wake the shoulder up. So how far can you internally rotate in this position? Turning knuckles in to hip, trying to show bicep into the ribs. Make sure it's not shoulder jumping forward. Make sure elbow is locked. From there, extend as far as you can. Maintain IR. Externally rotate, flip thumb back. Squeeze to the ear and finish through. All the way down, same idea. Assess the workspace. Axial rotation, internal rotation. Bicep turning in, ball showing out. Extend. Tension on the ball. Axial. Squeeze the ear. Finish through. So things we're looking for, the elbow wants to bend, don't let it bend, or that shoulder wants to hike forward, try not to let it. Max out IR by itself. Extend, axial, and hover. So tails and rails for shoulder IR, the shoulder sleeper stretch. It's actually the same thing we just did for the hip. It tends to be a little bit tricky at first. So same idea, we're gonna do 1 round in my favorite regression, and then 2 rounds in the side lying sleeper, the more commonly trained position. So you can do this actually in a bear sit if you want to be in your bear sit. Otherwise, again, leg out of the way. Here's what we do. We take our right elbow right on top of our knee. If you need to prop your elbow up a little bit based on the length of your legs, that's fine. You can go a little bit more forward if that's more comfortable. Make sure the elbow is not pronating or supinating. Really common, the elbows don't want to pronate as you do this. Try not to let it. Ball towards the floor the whole time. Now, IR of the shoulder has to be the humerus actually turning. So take your hand, anchor your shoulder low, and use your elbow to actually guide the shoulder into IR. So my hand's here, making sure it's not a scapula hike, guiding that shoulder down. Using the elbow, I internally rotate, and if you look, notice my humerus now is actually turned down towards the floor. Don't go too far and make it one of those. Anchor that scap, and then breathe. So if you think about those capsule cars we've been doing, we're basically just in a stretch in that position, making sure it's not the scap hiking around. To make it a deeper stretch, if this is easy for you, turn your sternum towards your bicep. That's going to put a bigger stretch in the back of the shoulder. One more breath. Your Pale's effort, you're going to radiate tension and you're going to push up, not just your wrist or forearm, but your entire Humerus is going to try and externally rotate against this top arm. So same idea, 1 round, 10-second pail, 5-second rail. Low tension here in the regression. Start to push bottom hand up into elbow, trying to turn that bicep back in your hand. Fighting up into the elbow. You should feel the back of the shoulder start working. If you feel the front of the shoulder, make sure scap is still low. So you're trying to turn that arm. 3, 2, 1. Rails effort. You're going to try and pull now the ball away from your elbow, further internally rotating. Squeeze the pec. Hold strong. Don't let that shoulder hike up or that elbow rotate. 3, 2, 1. Relax. So, to me, this is how I like to regress the shoulder sleeper. The typical, more commonly trained position is side lying, simply because it lets you get more weight onto that shoulder. Same idea, the whole goal here is disassociating, so you have to make sure that scap isn't helping. We lie on our side like this. We take our block, elevate our head, we bring our feet up in line with hips. Use your hands, reach your butt backwards. That gives you a little bit of room here, such that the weight is now on my legs and not just my shoulder. From there, bend the elbow up. Progression here, if you have a lot of IR, would be elbow higher. Regression, if you're not sure, is elbow lower. The shoulder can be slightly protracted, slightly forward, that's okay. Make sure it's not elevated near your ear though. So same idea, hand anchor, scapula to the floor, pin it down. Use your elbow, gently guide yourself down into IR of the shoulder. Don't go too far, make sure that scap's on the ground. Make sure the elbow is not jumping around. Doesn't matter how far in the stretch you are, but give me 3 breaths. With the inhale, feel the rib cage rise. With the exhale, let the shoulder just sink into the stretch passively. Hands anchored low. Again, if you want to feel a bigger stretch, turn your sternum towards the bicep. It's going to put more line of stretch. 2 rounds of pails and rails. This one a little bit higher tension. Squeeze that ball, irradiate tension, build up total body engagement. Start your pails effort. Again, same idea as before. We're trying to now do this. Externally rotating out of the stretch. So big breath in, pails, start to push. Trying to externally rotate up into the top elbow. Should feel posterior shoulders start working. 10 seconds, ramping slowly, 30% to 40, 40% to 50, 50% to 60, hold, 3, 2, 1. Rails effort, squeeze that ball, start to actively internally rotate, try and pull away towards the floor. Shoulder stays on the ground, don't let the elbow change alignment. And relax into the stretch. One nice breath. If you need to progress, feel free to slide up slightly. Again, block that shoulder, find your passive stretch, guiding down with the elbow. Make sure ball is still towards the floor. One big breath in. Build up total body tension. Pails effort, start to push up into that top forearm. 10 seconds, you're ramping 50% to 60. 60 to 70. Make sure that you're in a pain-free range. Stay here if you need to. 70 to 80 and fight right there. 5, 4, 3, 2. Rails effort, squeeze the pec, squeeze the bicep. Try and pull with that regressive shoulder away. Hold strong. 3, 2, 1. Set down. Let the shoulder just sink. No tension. One nice breath. Slowly out of the stretch. So again, probably going to take a day or two to get the hang of these sleeper stretch pails and rails for the hip and shoulder. You want to really feel both sides of the joint working here. So what I'm doing, I'm in this stretch, right? My pails effort, I'm trying to push out of it. That's going to strengthen posterior shoulder. And then rails, I'm trying to pull deeper into it, trying to hit anterior delt, pec, bicep, all this regressive tissue. So working both sides of the joint. Take your time. Let me know if it needs some help, okay? From there, we're going to move on our challenge for the shoulder. You're going to need your dowel. Now, if you have like a pole, this would also work, but I figured just to show you with the dowel would be simpler. Tennis ball is going on the low back. Now think of our swimmers. So we do swimmer hover type movements. We start on that low back position. We're going to work on just the lift off as a challenge. So take this dowel and block either your shoulder or your elbow. The elbow is going to be harder. The shoulder will be a little bit easier. So let's actually go shoulder today. Block that shoulder as a reminder not to let it dump forward. So this is going to aid us in disassociating scapula from shoulder joint. Just to show you from the side, what we'll do, build up tension, squeeze that ball, we'll get 6 reps, keeping that scapula retracted. Attempt to lift your hand behind your elbow. Now it's okay if the elbow and hand move together. Hold if you can, and set down soft. If there's any pain in the front of the shoulder, regress here. You could go wider and work in this position. Okay, you could also, if you really need to regress, work on your Cuban rotations instead, those capsule cars. But let's get 6. Retract, lift away, don't touch the dowel, set down soft. Reset the dowel for some added challenge. Last 2. And set down soft, 1 more. So again, shoulder rotation here, all about disassociating. On that lift off, what I often see is when we lift away, I'll see this happen. So here we're challenging ourselves to keep that scapula, prevent that coupling, and lift just from the shoulder joint. Should really get fatiguing again on that posterior shoulder. Back through the same series now for our left side. Reverse shoulder cars first. Let's assess the workspace. Looking at that capsule card, good tension. Axial rotate. For me, right away, more IR on this side. I can notice it immediately. Extend. Notice if you have more IR, you'll also have more extension. Rotational control leads to more linear control for the shoulder and the hip. Rotate and finish overhead. Actively internally rotate. Extend. Good tension in the dowel. Externally rotate and hover. Squeeze tight to the ear to finish. 1 more. IR, turn the bicep, not just the wrist. Extend. Externally rotate, hover and squeeze. 2 options for our shoulder IR. First one is that regression seated. Same thing if you prefer to sit up and bear sit, you can do the exact same drill from here. If you want to step the leg out of the way, that's also fine. So let me just show you a little from the side so you can see what's going on a bit. Shoulder is low. I anchor it down with my hand, make sure the elbow is not turning. Use the hand, pull into the stretch. Notice humerus actually turns towards the floor. You can even grab it and turn the humerus if you need to. Make sure it's not the scapula. Big breath in. 3 times as you breathe in, get tall. As you breathe out, let that shoulder sink away from your hand and let the arm sink to the floor. 1 more. Same idea, Pale's effort, we're trying to externally rotate out. Rail's effort, we're trying to pull further. Big breath in, radiate tension throughout the body. Squeeze that ball. Start your Pales, pushing up into top elbow, 10 seconds. Low tension here on the regression. 5, 4, 3, 2, 1. Rails effort, pull away. Lift off and hold strong. Try not to let the elbow change angles. Set down. 1 nice breath. Now we're into our side lying. Same as we said for the hip. If that was a great exercise for you, you really felt it, no reason to move forward. Stay there and work the regression. Use the drill that works best for you, regardless of what I'm saying. Find this side lying position, pillow for the head. Legs come up. Use the hand, shrimp those hips back. We start with that arm nice and straight, bend the elbow. Again, progression. Regression for me, I noticed more IR on the side, so I'll progress height of the elbow slightly. Hand blocks my shoulder, anchors scapula to the ground. Using the elbow, I pull into that stretch. 3 nice breaths. As I breathe, I turn sternum over bicep to get more tension. Again, that's a progression. Make sure the elbow is not turning. Make sure you're not cranking on it. Last breath. Build up total body tension. Squeeze that fist, squeeze the thighs, squeeze your glutes, start your Pales. Attempting to externally rotate, pushing up into the top forearm. 10 seconds, 30% ramps to 40. 40% ramps to 50. 50 to 60. Fight in this position. Hold. 3, 2, 1. Rails effort. Squeeze pec, bicep. Shoulder stays on the floor. Try and pull away from the elbow and hold strong. Set down soft, one nice breath. Second round, again, working up now to a high tension set, 10-second ramp, getting to 80% tension. Build up that total body engagement, big breath in. Start your pails, pushing up. 10 seconds, 50% ramps to 60, 60% ramps to 70. Shake should be shutting on here. 80% stay there. 5, 4, 3, 2. Rails effort attempt to lift away. 3, 2, 1. Set down. Let the shoulder relax into the stretch. Come on out of position. We finish up week 2 homework with our shoulder IR liftoffs in that swimmer position. Again, the regression here would be simply working our bent arm capsule cars instead. So if it's painful for you to go behind the back, or you feel like right away that big compensation is happening no matter what, just work these instead today. Again, you can explore different angles, go a little higher, go a little lower, go a little in front, but just get good internal and external rotations. Otherwise, hand sets down. On this side, I have more IR, so I can go higher up actively. I'm able to get my hand there without setting down. I'll challenge myself. Again, the dowel blocks my shoulder to make sure I'm not coupling. Scapula is engaged, retracted, good total body tension. Squeeze that ball. I lift my hand from my back, attempting to keep the hand behind the elbow as best I can. Try not to use the wrist. I set down soft. Again, regress, go a little lower. Good tension, lift away. Remind yourself, keep that scapula engaged. Press that dowel back if you need to. Take your time. Again, you could even go here if necessary. Last one coming up. Very nice. So if you felt like that was pretty confusing, if those pails and rails or those challenges just look like you think, it's going to give you trouble or you're confused at all, please continue watching. I'm going to take Danny through a few of those and talk through some common weak points, common issues I see. I think it should help. What's up, everyone? Hip internal rotation, pails and rails tends to give people a lot of trouble. So I wanted to talk Danny through a few options, simplify the thought process for you. So we'll start out in half frog. So half frog, I love to use this position as a regression to start teaching hip internal rotation to really focus to disassociate. So I like the position because it really helps with figuring out where the low back is in space. So when we first come down in half frog, before we start our pails and rail set, we want to breathe into this position and really think about letting the low back flatten into the floor. The idea is both pelvis points need to be directly forward. Really often, this hip will kind of hike up, and I'll see this hip really shift. That's going to cause pinching in front. So we breathe into the position. Now, another common issue is people simply set up with their leg too far into the position, way too much hip flexion and abduction, and they're again going to feel some pinching in front. So you can always regress the height, and if you needed to and it was tough to flatten that back, you could even elevate your belly by sliding a small pillow underneath. So the pails and rails here is quite simple. She builds up total body tension. Make sure that pelvis is in the floor, nice and flat back. Her pails effort, she's actually going to drive her heel down. So she's driving through her foot, educating that lateral hip to work. So we build up our tension, work through our pail set. For our rails, no change in alignment, but she drives inner thigh into the floor, actively pulling into IR. So we note how high she can actively get off the ground. For her, obviously, a little bit of a regression. So 90-90 we'll talk through next. So 90-90, couple big things we'll see for a beginner or someone who's maybe being a little sloppy or letting things help out, but we'll again see that same hip hike. So we'll see this hip really shift up and this lateral bend. The way we're going to get around that, two options. She could either, again, take a pillow under her front hip so she could lift her hips up a little, putting less stress on this trail leg. Or what we could do is take the lead leg out of the equation by blocking the thigh. So we lift the knee up a little bit, taking external rotation out of it, allowing her to really focus on the trail leg. So option one is to post this hand wide. She turns her sternum towards that trail thigh, and she would breathe into this position. Since we know Danny has a bit more mobility than that, she can take both hands and anchor right into the hips. So bring both hands up for me. Hands right on top of hands, and what she would do here, breathing into the position, but as she breathes, she's trying to let this hip sink down into the floor. So she uses the weight of her hands to help. We breathe into the position, same idea, focus on good rib cage movement, teaching the nervous system to relax into the stretch. Her Pale's effort, she irradiates total body tension. Same idea as half frog. Pale, she starts driving her heel down. Again, educating lateral hip to try and push out of the stretch. We build up that tension, work through our Pale set, and then our rails, again, the opposite. She starts driving thigh down, attempting to lift, and then shortening this angle. So instead of just lifting off, she actively pulls the T-spine towards the foot, squeezing down, trying to lift the heel, and shortening that angle. She'd relax and then breathe into the stretch. She could use her hands to find a new position. So to me, those are the two options I like to start with for Pales and rails, half frog, then 90-90. A nice challenge that I want to talk through is that bear sit IR hinge. So Danny will come into her bear sit position. Now, a few options here. The first one, we usually go hands behind, so she brings her hands behind. That way she can take some weight off of her hips, so a little bit of a regression. One option, if this is really challenging for you, she could even straighten this leg just out of the way, just let that leg straighten, and then we could work hinges here just so we're not limited by that opposite leg. So we talk through this. I love this drill because it teaches the hip, knee, ankle, and foot all to rotate together. So we lead with the ankle, she plantar flexes. She tries to lift that heel and she starts to internally rotate, letting that pinky toe pick up and squeezing inner thigh for the floor. We don't go too far because we don't want to see that spine follow. So for Danny, that's about it. If she goes any further, we see that low back twist. So we can get a rep here. As she pulls back, heel turns in and then hip follows. So again, ankle, knee, and foot rotating. Come into bear sit. So if we want to go from a full bear sit, nothing really changes. Foot leads the way, extend the ankle, heel lifts, internally rotate, she squeezes thigh down, no following in the spine. Externally rotate back, squeeze the glute, pull the heel out, and follow through. If we're going to progress, we would just lift the hands. So she bring her hands right out in front. She can either squeeze them or just make fists. No change, ankle plantar flexes. Heel drives out, internally rotate, externally rotate back. So to me, some common ones we'll be working on for hip internal rotation, half frog, Pales, and rails, working on that lift off. Love that one to disassociate low back from hip. 90-90, obviously that's something we'll be challenging a ton, Pales and rails, traditional 90-90. And then those bear sit IR hinges, kind of putting it together and teaching the hip, knee, and ankle to rotate. Let me know if that helps. So shoulder internal rotation tends to be even more confusing than hip internal rotation. So Danny again is going to assist me here. So we're going to talk through the seated shoulder sleeper. It almost looks like a bear sit type position on one side, and then we just straighten her other leg out of the way. So Danny positions herself with her elbow on her knee. She puts her hand right on top of the shoulder to make sure the scapula stays down. And then with her elbow, she's going to pull down to find passive shoulder internal rotation. So if she didn't have her hand here, what we often see is the shoulder hike up and forward, that coupling pattern of scapula and shoulder. So again, use that hand to resist it and then really pull down with the elbow to allow that internal rotation to take place. She would breathe into it. As she relaxes and the nervous system decompresses, she can deepen the stretch by turning her sternum towards her biceps. So she deepens that stretch. She put a little more tension on that posterior capsule. So right now she's feeling a stretch in the back of her shoulder. She would irradiate tension, same idea. Her Pale's effort is her attempting to externally rotate out of the stretch. She starts to push her bottom arm up into the top, fighting to try and turn that shoulder back. She works through her Pale set and then into rails where she attempts to internally rotate, pulling actively away from forearm, still not letting that shoulder blade help. She would set down and breathe into the stretch. So that's my favorite regression, also a great training option. Side lying simply puts a little more weight in the shoulder and challenges you to get more into horizontal adduction. So lie on down. We set up the block for the head, the legs come up in front. Puts her hands down to shrimp her hips backwards. She presses her hips back. Same exact setup. So hand goes on top of the shoulder. She blocks that shoulder in the floor and then she uses her elbow to passively internally rotate. Again, we see the humerus actually turn. She's got her hand here to make sure that scap is locked down. She breathes into position. quick check-in to make sure the elbow is not rotating, rib cage stays down, her neck's at a good angle. After a few breaths, she builds up total body tension. Her pale set again, she's trying to externally rotate, pushing up and out of the stretch. So she would fight, building up tension, working through her pales, no movement. Her rails, she thinks about that regressive tissue, pec and bicep, and actively pulls away. Hold strong, and then she relaxes into that new range of motion. She'd breathe for a moment and let the shoulders sink into the stretch. So those are my two favorite options for the sleeper. I also want to talk through the shoulder IR liftoff, the beginning of the swimmer, as I've been getting asked a lot of questions about it. So Danny brings that same hand on her low back. This is an internally rotated position. So if getting here causes some kind of pinching or pain, often we're going to see that same coupling where that shoulder wants to jump forward. So if this is too much, she could regress by bringing the hand kind of down to her hip. But for her, this is a good position. So she builds up tension. The key here is scapular retraction first. She pinches that upper back. Her elbow is going to stay here as best she can, and she's going to lift off and pull her hand away as she attempts to not allow that scap to jump forward. That would be one rep. Let's show them from another angle. Go ahead and face that way for me. So same thing, hand on the low back. Good total body tension. Scaps retract first. We don't want that shoulder blade to jump forward. She's going to attempt to lift off, pulling her hand to mine. And she holds, trying to minimize any shoulder coupling. Set down soft. So, my favorite variations to train pales and rails, seated, then side lying, regression, progression, and then I love those swimmer IR liftoffs. We'll work them in all types of different positions. Again, I hope it's been helpful. Please drop me some feedback.